Welcome to another session on Ask Me Anything session with me, myself, Dr. Tanima Singhal, and I am from Maa-Si Care Clinic, and I am here to resolve any of your queries related to breastfeeding. So this time I've got a lot of questions. So let me start them first. And if you have not filled the form for asking the questions, you can write in the Q&A box, and I'll answer them after finishing these questions. So you can write your questions in the Q&A box. First, I'll finish the questions which were asked by mothers by filling the forms. And then later on, I'll take your questions which are in the Q&A box. So let me start with the first question. First question is from Ritika. Baby do not latching and low milk development. So Ritika and all the other mothers, I have already a lot of times informed all of you about how to latch the baby or how to improve the milk supply. But because I'm seeing this question being repeated again and again, so let me tell you all about it. So see, breastfeeding is all about demand and supply. Just a simple thing, you think that you are standing in the kitchen and you don't know how much food to make. Then obviously after a certain time, you don't want the food to be wasted. So if you are seeing that there is no demand from people, the food which you are making is not taken up, is not finished by the family, obviously next time you will make less food. Same thing is with the brain. If there is not enough demand, the supply will be less. But when the baby is born, naturally the milk supply is good. But if there is no enough demand, like the baby is not on the breast, put on the breast regularly, or the milk is not expressed, that extra milk is always taken by the brain as extra and which is not used, and the milk supply will go down. So the basic concept about improving milk supply is demand and supply. Now, many of you might think that, and basically also for improving the demand, we have to do major three things. Either the baby should breastfeed, or you should pump, or you should do hand express. Now, if your baby is not coming on the breast, then still you have to regularly pump out the milk so that there is demand creation for the brain. Many times what happens, mothers start doing their pumpings, but the milk supply is very less, 5 ml, 10 ml, or sometimes drops. And they feel, what is the use of doing it? I'm pumping and also I'm not getting milk supply. So that demotivates them. But you have to always understand that your demand is important. And when you see less milk supply, yes, I understand that is a demotivating factor. But then the most important thing is a support system. You should have a good support system. And I would preferably I would ask you all to have a good support system from your lactation consultant. So now, as you all know, that it is difficult for you to connect with a lactation consultant throughout. But we offer that kind of things that we offer the mothers, because this has been a very constant thing that mothers get demotivated. So most of you are aware also that we have started one-on-one consultations in a way that we are 24/7 connected with our patients. So I've started this program recently because this is a very common issue coming up with the mothers, that they feel demotivated. And previously our weekly sessions, because the mothers need more help. So we have come forward one step more, where we are connecting our doctors to the patients directly, and the doctors directly numbers will be connected to the patients, where they can connect with their doctor 24/7. They can just drop in a WhatsApp message and they can connect with the doctor. But those programs are different, as you can all understand, that demands a lot of time, dedication, and doctors have to be really on regularly see their messages and phones. But I have come forward this because this is most of the thing. This I really wanted to work, but previously I was working alone, and that time I didn't have that much bandwidth to take so many patients. But as all of you are aware now, that I have a team of 4 more doctors along with me, so that we can give this kind of support to the mothers, where we can connect one-on-one, and our doctors are connected with the mothers 24/7. So those programs are different. If you have any queries about these programs, you can contact to the helpline team. But our main motive is to keep the mothers motivated enough, not these one-on-one sessions on every like weekly, but we want to reach out to you every day, where you can connect with your doctor directly. So this kind of support, because you need it right now, because I'm seeing these questions being repeated every time the same thing: milk supply, low milk supply, baby not latching. So basically, as I told you, you have to regularly create the demand. If the milk supply is less, please still work on it. So it will be like when you start creating demand, the brain will understand the demand and it will start making milk supply accordingly. Second, the things which you have to help your body to do that. So number one is hydration. Number two is improving the milk flow. Third thing, taking the galactogogues, which I have already suggested, lactomagic powder and moringa tablets, and some other medications, but those are allopathic medicines which has to be taken only under guidance of your doctor, like your lactation consultant. So it is important to reach out for one-on-one support for having any other medicines. But lactomagic and moringa, because these are 100% natural, so they can be taken regularly. Next thing is you have to do skin to skin with your baby. Fourth thing is the most important thing, you have to check the baby's weight regularly. Once you check the baby's weight, your baby's formula milk is going down, you will feel more confident about it. So these are the most important things for improving the milk supply. And for latching issues, I always ask the mothers for mid-bottle feeding or mid-katori feeding. If your baby is small and less than 1 month or less than 2 months, then I would prefer you switch from bottle towards the palada or the katori, because babies get used to the flow of the bottle and they start rejecting the breast. So that's why it is preferred that the baby should be on bottle feeding, or the baby should be either on the katori feeding or on the this palada feeding. They both work well. So again, the same thing. It feels very demotivated when your baby rejects the breast and doesn't come that. That's why it is so important to connect with your doctors regularly on a regular basis, who can guide you, who can push you in that. So as I just told you about the breastfeeding programs which we are running nowadays, that will connect your doctor to you 24/7. That will be the most important part which we have faced like now, that mothers are facing these issues. So moving ahead, the next question is Vartika's question from Vartika. Milk supply is low and now my baby latch, but no more than 2 seconds. Then he removes and then he doesn't suck properly. So see, Vartika, as you said that the baby has started now coming on the breast and at least for 2 seconds the baby is coming, I would say please keep on doing that. Previously, the baby was not coming on the breast and now at least started coming on the breast for 2 seconds. It's fine. It's okay. So what I would suggest that what you do whenever you are giving milk to the baby, you just first try giving your breast milk. And once he leaves, you give the katori feeding or the palada feeding, but don't give full amount. Give half amount and then take the baby again on the breast. So this way there will be 2 times of demand every time. This will help the baby to cope up with coming on the breast and do a lot of skin to skin and cuddling. That will help a lot. And for milk supply, I've already answered this question, that how to improve your milk supply. Next question is from Latika. Latika says, trying after the 10 days of delivery, but my baby is 5 months old and he's still on formula feeding. Latika, please don't waste time now further. You are working for last 5 months and you are not able to improve the milk supply. So that means it will not improve naturally. So I would suggest please reach out to the team and get your consultations done so that you can improve the milk supply. The baby is already 5 months old. Now please don't waste further time there. Next question is from Sophia. How much time I have to pump each breast, and do we have to pump both breasts at a time or at varied times? So first of all, how much time? Usually I don't prefer mothers pumping for more than 10 to 15 minutes. But then again, I have to see what is your milk supply and we need to first understand what is the current status. Then only we can tell you in a better way how much time you should pump. Second thing is pumping one side or both the sides, obviously both the sides, because we need milk from both the sides. So both the sides of milk pumping is important. So better to have a dual breast pump so that you can have pumping done from both the sides together. Next question is from Chetan. How to improve breastfeeding? This I have already answered. I just answered how to improve the breast milk, like breastfeeding. Next question is from Vinita. I am facing low milk supply even after taking medicines. Need your support and guidance to increase breast milk quantity. So Vinita, I'm not sure which medicines you are using, because you have written just after taking medicines, because we have to understand what dosages you are taking, since how long you are taking. Are you taking the same kind of dosages? Because every time we have to taper the dosages also. So first we need to start with a common dosage, and then we have to change the dosages. We might need to increase it, we might need to decrease it. So we need to first understand which medicines you are taking, for how long you are taking, and what dosage you are taking. Then only we can let you know that is this medicine fine, or you need to add on some medicines, you need to change some medicines. And it is not only about medicines. You need to work on some supply and demand protocols also, because medicines, they are basically like a helping factor. They are supporting factor. That is not the only thing that it will make your breastfeeding journey smoother. It will only help you. It will only support you. You can't go with medicines for a longer time. You have to anyhow naturally get your milk supply good, and you have to do it naturally. But in the initial days, yes, we need to support our body to improve the supply. But that doesn't mean that medicines are the only sole reason for improving the milk supply. There are various other factors which I just told you also. So you need to work on a holistic way to improve the supply. Next question is from Pinky. Does one breast has capacity to cope with needs if one side supply is less? Weight of the baby is gaining 200 to 250 grams per week. So Pinky, baby's weight is very good, but you have not mentioned what is the age of the baby. If your baby is small, like 1 month, 2 months, then obviously 200 to 250 grams weight is very good. But because you are saying that you are producing milk only from one side, so for now it is fine. But as the baby will grow, the baby's demand will increase. So we have to get milk supply from both the breast. So Pinky, you have to work on improving the milk supply from both the breasts so that you get milk. Like obviously for single breast, the baby is like it's okay for now, but the baby needs milk more in the future. So the baby might be needing, so we need to produce milk from both the sides. So next question is from Maa-Si. Maa-Si says, few drops of milk supply, how to improve? So Maa-Si, as I just answered, yes, I understand few drops of milk supply are a little demotivating, but I would suggest that if you are under treatment of ours, whatever protocols are being given to you, please follow them and reach out to your doctor so that they can give you the further treatment protocols. And if you have not taken consultations yet from like any of our doctors, please reach out to them so that they can work with you. Like they can just take your whole history and then can tell you what treatment plans you should follow. So it was always advisable to take an expert guidance, because regular things I'm telling for every AMA sessions, regular things, how you can improve the milk supply. But I'm seeing these questions are coming again and again. That means the general information is alone not helping you. You need to have that kind of support from the experts directly. So there are two types of programs which we are running. They are weekly programs where you can connect with your doctor by renewing your consultation weekly, and the other, but you will get calls weekly basis. But right now we are also running because we are seeing mothers are saying that they need support 24/7. So we have made some programs where the doctors are connected with you on WhatsApp or through calls 24/7, so that you can, whenever you have any slightest doubt in your mind, you can just message to your doctor and they will reply. So these programs are obviously different because doctors, when they need that kind of dedication for their patients, they can't take a lot of patients. So we have to like give them very less patients so that they can focus on their patients more. So less patients for those doctors who will be going for one-on-one consultations where the patients are connected 24/7 with their doctor. So those programs are different, which you can reach out to our team and they will guide you about it, that which programs are suited. And each and every program we are making right now are customized as per the needs of the mothers. It is not like we are giving any general programs. We are thoroughly going and understanding each and every mother's, like what are the issues they are facing, and then customizing the programs. Otherwise, you can go for one-on-one consultations, which are available for weekly calls, and you can go for that. Those are also available. But if you feel that you really need hand holding, you really need to have that kind of support from the doctors, wherever you get low in motivation, low in daily, then you can reach out to them. So as I just said, few drops of milk supply, you can definitely improve Maa-Si. You need to just follow the proper protocols. I have just, as the starting of this webinar today, I have answered about how to improve the milk supply. You can follow that. Next question is from Taba. Taba says, my baby plays with breast with her tongue and sucks, but literally doesn't drink. But when I insist her to drink, she gets irritated. So Taba, if your baby is more than 3 months, this is a very common thing which will happen. So you have to, this babies does because they are distracted most of the times. So what you need to follow, you have to just dim the lights of the room so that the baby is not distracted. Second thing, don't push your breast in the baby's mouth. You should always let them come to the breast. So as you said that the baby tries to suckle, tries to come, but when you try to push, whenever you try to insist, the baby leaves. So in that way, you just hold the baby skin to skin with you, just hold her close to you and let the baby come on the breast by itself. Maybe for a few days, the baby will just come on the breast and just play around. But slowly, the baby will start coming on the breast and will start suckling also. And here I would suggest you some exercises. Like what you do, you just put your small finger in the baby's mouth, and once the baby starts suckling, that time you just take the baby on the breast. Second thing, if possible, please try to remove the bottle, because bottles, they are more easy for the babies and then they don't want to suckle on the breast. And if you are giving bottles, go for the bottles which are not, the milk is not dripping by itself. You have to take those bottles in which the baby has to make attempt to suckle the milk. So those kind of bottles you can go on. But although I would suggest that if you can shift towards the Katori or the Palada feeding. Next question is from Nisha. My son doesn't take feed directly from me. He starts crying. So Nisha, what is your milk supply? You have not mentioned here. If your milk supply will be less, then obviously it is very common for the baby to do like that, because babies are hungry. They don't have any problem with you. They want food. They want milk. And if that milk is coming from the breast, if that milk is coming from the bottle, they will always understand that as the main source of nutrition for them. But if that milk is coming from the breast properly, then they will try to suckle and they will be more cooperative. And for your kind information, because I would like to tell you about many of our relactation mothers who are working very closely with our doctors, they are getting very good results. And some of the relactation mothers are now put on directly breastfeedings, and the babies have started latching also. So it is always the babies, they are not at fault because they need milk. And if the milk is less on the breast, the baby will not cooperate in a better way. So I don't know what is your milk supply, Nisha. You have to work on, like if your milk supply is good, then we can work further. But if your milk supply is less, first work on improving the milk supply. Next question is from Hemlata. Baby cries to breastfeed to sleep. It's fine, Hemlata. Many babies, because they are again not at fault. We have done that. Whenever we want to make them sleep, we take them on the breast. And when they grow up, they become that habitual to that, we want to put them away. That doesn't work. If you have put out that kind of a habit for your child, slowly it will go away. So there are a lot of tips about it, how you can get the baby away from the breast if the baby is more like older and you want to wean off. But then obviously you have to go for it, because that is very customized, because I have to first understand what is the age of the child, what are the solid intakes for the baby, like how many times the baby is taking breastfeedings. All these things, a lot of things are there to understand when we are talking about weaning. So we have to understand and give the plans and protocols accordingly. Next question is from Nazmi. Baby is not latching. Again, the same thing, baby is not latching. I have just answered this, how to latch your baby. नेक्स्ट क्वेश्चन इज फ्रॉम शमा. मैम, मेरी बेटी जब 2 महीने 15 दिन की थी, उसको अचानक मेरा दूध पीना छोड़ दिया. अभी वो 4 महीने की हो गई है, बस वो नींद में दूध पीती है. देखो शमा, सबसे पहले आपको एक चीज समझनी है कि बच्चे ऐसा क्यों करते हैं. और ये बड़ा कॉमन है कि बच्चे 2.5 से 3 महीने के आसपास ब्रेस्ट फीडिंग में कम इंटरेस्टेड होते हैं. क्यों? क्योंकि 3 महीने में बच्चों का ग्रोथ स्पर्ट आता है. जब उनका ग्रोथ स्पर्ट आता है, उसके फीचर्स आपको 10-15 दिन पहले से दिखने लगते हैं. तो क्या होता है कि बच्चे करीब 2.5-3 महीने के बीच में थोड़ा क्रैंकी होते हैं, फसी होते हैं, क्योंकि उनका ग्रोथ स्पर्ट आता है. उस समय वो थोड़ा ब्रेस्ट फीडिंग को लेकर के या तो जल्दी फीडिंग कर रहे होते हैं या क्रैंकी होते हैं. तो मदर को का कॉन्फिडेंस लो हो जाता है, उसको लगता है मेरा मिल्क सफिशिएंट नहीं है या मेरा मिल्क का सप्लाई कम है. तो वो भी कोशिश करती है कि बच्चे का पेट भरने के लिए उसको ज्यादा फॉर्मूला मिल्क या ज्यादा बॉटल फीडिंग कराने लग जाती है. और बच्चे होते हैं समझदार, उनको लगता है कि ये आसान है, अरे ये तो बड़ी अच्छी चीज है, बॉटल मिल गई. फिर बच्चे ऑब्वियसली ब्रेस्ट को रिफ्यूज करने लग जाते हैं और बॉटल को लेना चाहते हैं. तो अभी जैसे आपने बताया कि 2.5 महीने के बाद से उसने ऐसा किया था, और अभी 4 महीने पे लेकिन वो नींद में दूध पी रही है. तो आप ये भी देख रहे हो कि जब वो थोड़ा नींद में होती है उस समय वो दूध क्यों पी लेती है। तो ऐसा नहीं है कि ब्रेस्ट में दूध नहीं है, दूध है, लेकिन बच्चा नींद में ही क्यों पी रहा है, क्योंकि उस समय डिस्ट्रैक्टेड नहीं है। तो आपको दिन में भी कोशिश ये करनी है कि बच्चा जब नींद में होता है, सॉरी, जब बच्चा दिन में भी आप कोशिश ये करनी है कि डिस्ट्रैक्शंस कम करने हैं। तो रूम की लाइट्स कम करिए। आपके घर के आसपास अगर बहुत शोर है या आवाजें बहुत आती हैं, तो कोशिश करिए कि आप ऐसे रूम में उसको फीडिंग करा पाए जहाँ पे शोर कम होता हो। इस तरह से आप डिस्ट्रैक्शन। और बच्चे 3 महीने के बाद जब माँ के पास आते हैं तो वो आवाजें निकालते हैं। तो जिस समय बच्चा दूध पी रहा है उस समय अगर वो बहुत आवाजें निकालता है तो आप उस पर रिस्पॉन्ड नहीं करेंगे, क्योंकि उससे बच्चे को लगेगा आप उससे बातें कर रहे हैं। तो बच्चे को उस समय शांति से दूध पिलाएं, जिससे बच्चे का पूरा ध्यान माँ के फीडिंग पे हो। इस तरह से आप दिन में मैनेज करेंगे, धीरे धीरे बच्चा रात में और दिन में भी ब्रेस्ट फीडिंग पे वापस आ जाएगा। 4 महीने के बच्चे को थोड़ा मुश्किल है, लेकिन ऐसा नहीं कि इम्पॉसिबल है। अगर रात में बच्चा दूध पी रहा है तो आप दिन में भी इन टिप्स के साथ ट्राई कर सकते हैं। Next question is Shobna. How to increase breast milk that will be sufficient for twins? Good question, Shobna. So I always say that twin babies, it is the most easiest part to improve the milk supply, because there is regular demand for the brain. So what you have to do, regularly put the babies on the breast. You have twins, so they can be on the breast. And I know it is difficult for you to breastfeed them constantly. What you can do, you can just do that with the side lying position or in the football hold position. These two positions are good for putting the twins on the breast. And when there is regular demand for your brain, the milk supply will improve. But because you have to produce milk double for twins, so you need to take very good care of your body. You have to take very good care of your health and nutrition. So follow the tips which I have started in the starting of the webinar. I gave the tips about how to increase the milk supply. You have to just work on the tips. And if you are facing any kind of challenges, you can reach out to the team. As I just introduced, there are 2 types of programs, like weekly programs and one-on-one programs, 24/7 programs, which you can go and enroll for with us. Next question is from Shivangi. Why the milk supply is always not same? Good question, Shivangi. So my question to you, Shivangi, the cross questioning is, do you eat the same amount of food for for full day? Sometimes you eat less, sometimes you eat more. So it is same for the milk supply. The babies also do the same. They are more hungry in the evenings, while in the mornings they tend to sleep more. So that's why the milk supply gets adjusted accordingly. We have a very smart system in our brain. The brain works according to the baby's demand, and it makes milk accordingly. So that's why the milk supply is varying throughout the day. But I would always suggest that when the mother is not sure about the milk supply, you have to only check the baby's weight gain. If the weight gain is good, then nothing to worry. Next question is from Smita. Remedies for increasing breast milk. I've already answered this, Smita, how to improve the milk supply. You can just go through the starting of the webinar and you can work on those tips. Next question is from Shalini. How to increase milk supply naturally? Already answered. Next question is from Anu. Breast milk also not sufficient. Now he is suffering by cold and cough, so he is not taking solid food properly. What to do? Okay, Anu. See, this is a very, again, the thing that once the babies are ill, we feel that we should give more of our breastfeed. But when the babies are more than 6 months and we have introduced solid to them, and once they are ill and they are not eating, we feel that we should improve our milk supply so that we can at least nourish them with our breast milk. But please don't worry about it. When we are not well, we as elders, sometimes we don't feel like eating. It is the nature, it is body's nature of natural immunity, how to get your body healed fast. So that's why babies just reduce their food intake. But that's fine. Once they are well, the hunger improves, and that time you can improve their food intake and give them more nutritious food. And during when they are very ill also, they are not taking food properly, you have to give the food nutrition dense food. So if they are taking less amount of food, you should just think about it, that how can I make it nutritionally dense? So that way nutritionally dense food will help your baby to recover fast from any kind of illnesses. And that will, so if the baby is taking less food also, still it will be fine. And please don't worry about the milk supply, because again, that is a different thing. Because if you start worrying about milk supply and put the baby on the breast and the baby starts refusing food, that is again a problem. So that's why we don't want to like reduce the solids for the baby. So baby is not well, not taking solids properly, give nutrition dense food. And once the baby is well, you can switch back to the same kind of protocols, like same kind of routine which you were following before. Next question is from Shiba. How to increase milk supply? I have tried many things, but in vain. So Shiba, because many things mothers tell me that I tried this, I tried that, but always you need to do everything holistically and all together. Sometimes you are doing something, somewhere you read something, somebody told you something, you just did one thing, you just do second thing, you just did third thing. That will not help you. What is the most important thing? A proper protocol, a holistic protocol, and a proper guidance and a proper hand holding. So those things, when you will see the results and there is somebody who is asking you, how is everything going? How was your week? How was your day? So when you are having a connection like that with an expert, that will be a game changer, because there is somebody to take care. There is somebody who is equally concerned about your supply issues. There is somebody who is equally concerned about your breastfeeding. So this way, when you are connected with your doctor regularly, when you are connected with your lactation consultant regularly, that will help a lot, because as mothers we really want to do so much for our babies, but there is always something that we need an extra help. Somebody asking us every day, how is everything going? Is it all fine? Do you need some more help? So that's why I just told you all about the programs which we are running now. So just take those advantages, because if we have more patients, then we might not be able to adjust everybody, because as I just told you, the one-on-one programs, the 24/7 programs, they are very limited, because doctors will be spending time with their patients. So we will not be taking more patients more than up to a limit. So that's why just use it, yaar. Come on. Those who is giving you 24/7 support, think about it. Which doctor will give you your personal numbers to ask your questions whenever you want? So this is one thing, I'm just doing it for a trial basis, just to see how this works upon, because I want results for my mothers. I want them really to get their babies on exclusive breastfeeding without any hassles. So we are just trying to do it as a pilot phase. And if it works well, we might roll it. But if it is not working well, we might take it back. So that's why we are reaching out. We are just giving those programs where there is a hand holding 24/7. And you should just take advantage of it, because your babies are small. Every day the day is passing by, the time is clicking, and we really want the best part for our babies. Our babies are growing basically, and after 6 months their solids will also start. So please take that usage of the time and get your babies on exclusive breastfeeding. And I was telling yesterday one thing to one of my patients, that COVID came. Sometimes COVID ka brother will come, COVID ka sister will come, COVID ka uncle will come in future. But we have to give a good foundation to our babies who can survive all those, who can just fight with all those things. So this is most important, that we give a right foundation to our babies. And that is by giving breast milk, which is like, I just can't stop telling you about. I just can't only put it in fingers, like what are the benefits of breast milk. During COVID, when everybody was so stressed out, breast milk was one thing we never stopped asking the mothers. If they were even COVID positive, they were asked to breastfeed their babies. That is the beauty, that is the strength of breast milk. Next question is from Mahati. I have low milk supply initially, and now no milk as I stopped breastfeeding due to painful nipples. So Mahati, yours is a clear indication of a latching issue. You need to reach out to the latch expert. Please reach out to the team tomorrow. They'll connect you with a latch expert and get your issues resolved, Mahati. This is a very clear indication that you are facing latching issues. And you can try for cross cradle hold. That works well, but I don't know what is the age of your child. If your baby is more than 3 months old and already one kind of feeding the baby has mastered, it will be difficult to change the position, but at least that can be improvised. If your baby is less than 3 months, we can definitely work on cross cradle hold and improve the this painful nipples problem which you are having. Next question is from Sushma. Myths about fruits during breastfeeding. So Sushma, I don't stop mothers from anything. See, breastfeeding is not a punishment to the mother that don't eat this, don't eat that. Breastfeeding should be an enjoyable journey for the mother. She should remember her breastfeeding journey as a beautiful phase. It should not be, I couldn't eat this, I couldn't eat mango. I love mango, but whole summers passed down. I didn't eat mango. I don't want the mother to feel like that. She should enjoy her food. She should enjoy her life. She should enjoy her babies present in her life. It should not be a burden that I am breastfeeding mother. I can't eat this. I am a breastfeeding mother. I can't eat that. It should not be there. So no restrictions from my side. In my 14 years plus of medical practice, I have not seen any problems coming with any particular food for breastfeeding mothers. Next question is from Bala Abhirami. Tips to increase breast milk supply. Already given, you can just go through the webinar. Next question is from Tanya. Low milk supply, baby not latching, and when I pump, I get only a tablespoon of milk. Tanya, how many times you are pumping? If you are there in the webinar, please write it on the Q&A box, because this is important that the demand should be improved. If you are pumping once or twice and getting 1 tablespoon of milk, you can definitely increase it by improving the frequency. Also, because how long you are pumping, that is important. Mothers, many times they are pumping for 30 minutes, 40 minutes and getting 1 tablespoon, 2 tablespoons of milk. Then you have to understand the milk supply is directly proportional to the frequency. It is not about the duration. You can pump for 10 minutes, but it should be more frequent so that there is regular demand for the brain to understand the demand and produce milk accordingly. And also, Tanya, when you say that I produce 1 tablespoon of milk, you have to see what is the quality of breast milk. Sometimes the quantity might seem less, but the quality is very good. So that has to be seen by seeing the weight gain of the baby. So you need to check the baby's weight. But now, because I don't know what is the current weight, what was the birth weight, so I can't help you with it. But you need to just work around it. But yes, you can definitely increase. If you are getting 1 tablespoon of milk, please get help and get this resolved. Otherwise, it will start dropping even from 1 tablespoon. Next question is from Shruti. Baby sleeps during breastfeeding. Even his tummy is not full and cry after some time. Yes. So Shruti, because, if this is predominantly a nipple feeding. In nipple feeding, what will happen? The baby will not get milk properly. And there will be so much efforts to be made from the baby to empty the breast. And they get tired and they go to sleep. So you have to make sure the milk supply is good, milk flow is good, and the latching is good. And over than that, top up should be the active feeding. And how to see the active feeding? By seeing the neck movement. If the neck is moving properly and you can see the gulping movement, that means the baby is suckling milk. But if you don't see the gulping movement, that means the baby is only doing a passive feeding. So this way you can differentiate between an active feeding and a passive feeding. And if you are seeing that the baby is sleeping during the breastfeeding session and the baby is not hungry and a baby is not full and asking milk after some time again, then definitely you need to work on all these 3 things: milk flow, milk supply, and latching. Next question is from Shweta. What is the good position of breastfeeding? So Shweta, what I have personally seen, cross-cradle hold has been the best position till now for latching issues, for mothers position issues. The mother is more comfortable. Yes, but there is a learning curve. You have to first understand and master the skills. So cross-cradle hold might seem difficult in the initial few days, but once you master it, you will definitely enjoy your breastfeeding journey. I have seen very miraculous results with cross-cradle hold. You can just go through the cross-cradle hold videos. There is a learning curve. This is for sure that you have to first learn the skills properly and then practice it. Next question is from Sprita. How to increase breast milk? I've already answered. Next question is from Prajakta, general. What is general, Prajakta? I need to have specific questions which I can answer. Next question is from Mamta. Low breast milk. I've already answered how to improve milk supply. Next question is from Reshma. My baby is not latching at me, all due to formula milk, and I too not getting enough milk supply. Now I need your help seriously. So Reshma, now you know that you need my help seriously. Then I would again say, because I have already answered about latching and about milk supply in this webinar today, you can go through that. I've also introduced the 2 programs which we are running now. Once weekly programs and the 24/7 programs. Now, because we are connecting with our patients 24/7, with our doctors directly connected with our patients, those programs are different. We have recently rolled them out. You can just contact to the team and know about both the kind of programs, the weekly sessions or the 24/7 sessions. Next question is from Rashmi. Low milk supply. Already answered. Next question is from Bhavya. Can a 1.8 kgs baby breastfeed? Yes, why not? Why not 1.8 kgs baby not breastfeed? Babies are born with a natural skill of breastfeeding. The only thing is milk flow, milk supply, and latching techniques. If these 3 things are all in proper positioning, obviously a 1.8 kg baby can also breastfeed very well and very efficiently. Next question is from Prabha. How to increase breast milk? Already answered, Prabha. Next question is from Manasa. I am trying hard. Pumping, galactant substitutes in food. Still my milk supply is low. What else can be done to increase milk? It's 100 ml per day. Okay. So Manasa, I'll take a lot of things you've written. I am trying hard. Okay. I'm doing pumping. Fine, Manasa. But how old is your baby? If your baby is less than 3 months, please try for direct breastfeeding. Also, you're making 100 ml per day. You can definitely try for direct breastfeedings by the mid-bottle feeding or the mid-katori feeding, which I always suggest to the mothers when they are trying for direct breastfeedings. You said you are taking galactant substitutes in food. Please check out any kind of supplements which you are taking. Just check the contents of the substitutes, supplements which you are taking. They should not include any preservatives. I have seen maximum supplements having preservatives in it. So if you are seeing preservatives are added into your supplements, please don't take it. Preservatives are the chemicals which are added to the foods to improve the shelf life of the food. And they are not good for, especially for the breastfeeding mothers. So today, all of you listen, all of you who are taking any kind of supplements for improving the milk supply, please just check your containers. Just see if there are any preservatives added to it. Preservatives are not good for consumption, especially for breastfeeding mothers. So Galact has it. I have seen that. If any one of you is using Galact, you can just see on that. So you're saying I'm taking a lot of substitutes, still my milk supply is low. What else can be done to increase milk supply? So Manasa, I have already answered this in the start of the webinar itself, because my first question was about low milk supply, but I'm again repeating it. First is hydration, second is improving the flow, third is by keeping the baby skin to skin, fourth is by taking the supplements which I suggest is lactomagic powder and moringa tablets. Some other medication you might need because you are producing only 100 ml of milk, but because those are allopathic medicines which I can't tell you on, because they have to be taken only under the doctor's guidance. So you can reach out to the team. Otherwise, because 100 ml per day, obviously you need to improve the milk supply. And rest of the things are like checking the weight regularly to see where you are going, and a lot of skin to skin and cuddling for your baby. Question is from where I was. I was on Manasa. Okay. Next question is from Lata. Baby is having high palate. Can latch on breast effectively. Is it compulsory to give expressed milk to him? No, Lata, it is not compulsory. You just need to have a proper technique to latch the baby. If the baby is having a higher palate, that is also fine. See, you don't have to go till the upper side of the palate. The baby should have proper the proper areola in the baby's mother's in the mouth. So if the mother's areola is properly in the lower part of the areola is in the baby's mouth, if it is a high arched palate, that's fine. That's not a problem. You just need to have a proper technique of how to latch the baby. So basically, latching is always called as asymmetrical latching. So asymmetrical latching always works a lot, very well. So when you are doing asymmetrical latching, so if there is a high arched palate, still you can improve the latch by having a proper technique. So in my latch series, I just took, I think, around 2 months back, where I just took webinars only specifically for latching. You can just, where I made all these things clear how to have a good latch. So basically, when I'm talking about asymmetrical latch, the head should be little back. It should be extended. So when the baby's head is little extended, the chin is forward and nose is little back. So when we are taking in an extended position and holding the breast in U shape from below and getting the baby extended. So the chin will first touch the mother's breast and the nipple will be towards the upper palate. And in this way, when we are going inside, the baby can have a deep latch. And when a deep latch happens, that helps a lot in improving the latching things. Okay. Now moving further. Next question is from Himangi. How to increase breastfeeding? Already answered here. Next question is from Manali. Supplements I can use to improve milk supply. So Manali, the supplements, the natural supplements which I suggest is Lactomagic powder and Moringa tablets. But there are some other medications, the allopathic medicines, which are required, but that has to be taken only under the guidance of a lactation consultant or a doctor. So you need to reach out to the team to have a one-on-one consultation where you can be advised those medicines if required as per your current status, because you have not written how much is your milk supply. Next question is from Aprajita Chaudhary, increasing glow supply. Already answered here. Next question is from Monica, not getting enough supply per one feeding session. I am continuously sitting for hours for a 3-month-old baby. So first of all, 3-month baby, the baby is having growth spurt. I have already answered a lot of times about growth spurt, a lot of talking about growth spurt. So during growth spurts, the baby will be doing frequent feeding. And the growth spurts are 2 weeks, 6 weeks, 3 months, 5 months, 7 months. So they'll be doing cluster feedings, which is fine. It is for a few days, just manage for a few days. And you say that I am sitting for continuously sitting for hours. That means your baby is doing passive feeding. So you have to understand the concept of active feeding and passive feeding. So if you see the gulping movement in the baby's neck, that means they are actively feeding. Then only put them on the breast. If the baby is not doing active gulping movements, the baby is sleeping, that is a passive feeding. You don't need to put the baby on the breast at that time. This will save a lot of your energy. And obviously, it is so tiring to sit for hours feeding the baby. This way you can manage your times. Next question is from Minakshi, no milk supply. Already answered how to improve milk supply. Next question is from Sri Kanya. Baby is crying even after breastfeeding, but he is gaining weight as per the norms. And P count is also good. Why? So baby is crying even after breastfeeding. You need to see, is it the growth spurt right now? If the growth spurt, then fine. You just put the baby on the breast. The only indication that the baby is hungry is if they are not suckling on the breast and crying. If they want to come on the breast and want to feed more, you can do that if it is a growth spurt right now. And if this thing is happening basically for 3 to 4 hours cycle in 24 hours, then also it is normal, because cluster feeding 3 to 4 hours in 24 hours is fine. That is nature's way to keep up the milk supply and to maintain the milk supply. Next question is from Tejasvi. How to increase breast milk? Already answered there. Next question from Mayuri. Low milk supply and child not latching and not coming on the breast. Already answered. Shalini. In my breast, there is milk sometimes and sometimes not. Why? So this I have answered. Irregular milk supply. As I told you that we don't eat the same kind of food every day. in the mornings, in the afternoon, and the evening. You don't eat the same quantity of food. So how can we expect the same kind of food for the baby? The baby might eat less, the baby might eat more. So if the baby is on exclusive breastfeeding, the brain adapts accordingly and it changes the milk supply accordingly. Most of you would have seen the milk supply is better in the morning, but less in the evenings or the afternoons. So that's why the milk supply changes as per the baby's requirements. Evenings, babies do cluster feeding. They are more on the breast, but that's fine. Let the nature decide how much to improve the milk supply. If you are feeling that the supply is less, then do frequent feedings, which is called as supply demand protocol. But yes, without any just direction, don't do that. Otherwise, you will just burn out. You will feel so exhausted and tired. So you need to have a proper protocols which will help you, which are designed for you to improve the demand and supply protocols. Next question is from Shalini. No, this Shalini I have done. Next is from Sana. Low breast milk supply. Already answered, Sana. Next question is from Archana. Low milk supply. Baby birth weight 2.5 kg. 2.5 months 4.5 kg. Today 3 months completed. 50% approximately on breastfeeding. So 2.5 kg birth weight and at 2.5 months to 4.5 kg. So 2.5 months is 10 weeks. 10 into 2, 202 kgs, 2.5, 3.4. Weight is perfect, but as you said that it is only 50% breastfeeding, then you have to improve the weight by exclusive breastfeeding. So Archana, baby's weight is fine, but because only 50% of breastfeeding is there, so you have to work in a way that the baby's weight should improve by exclusive breastfeeding. So these are about the questions for today. And now let me start the questions one by one from the Q&A box. The next question is, so first question from the Q&A box is from Dakshayani. Hi ma'am, my baby latches well after following your instructions. However, my milk supply is still low even after I express my milk. I could express up to 25 to 30 ml. Please suggest how to increase more ml to express. So Dakshayani, why are you only expressing? Because you said that now the baby is latching fine. So I would suggest that every time put the baby on the breast and then do mid-katuri feeding or the mid-palada feeding and put the baby again on the breast after like half of the palada or half of the bottle. So more demand will improve the milk supply and more you can work on just making your body more like just working on your nutrition part. So water intake, massage and the compress for improving the flow, and lactomagic and moringa. And if the baby is taking top of milk more than 4 times, like formula milk, if it is more than 4 times, then obviously we have to give some other allopathic medicines also. So, but for the allopathic medicines, you need to consult us directly, because that I can't just share on a public platform, because it's allopathic tablets should not be taken without doctor's guidance. And just check the baby's weight also. If your baby is less than 3 months, the baby should gain 200 grams per week. And I am very happy, Dakshayani, that these instructions are helping you. I'm glad that it helped you that way. Next question is from Vinita Rajneesh. Ma'am, my baby is 56 days old. 56, okay, 60 days. Okay, fine, 2 months. From birth, she is used to bottle feeding. I was not aware on the lactation on demand and I was waiting for milk supply. When I got to know the fact, she is not latching much and I am producing very low milk, which is around 5 to 10 ml. I am taking Montolac tablet and Galac granules as recommended by my gynecologist, but no results. Is it possible for relactation now? Will I be able to produce more milk after 2 months of birth? Yes, Vinita. Definitely you can improve the milk supply. And as you are now aware about demand and supply, we need to just make a program for you where you need to work on the demand and supply and the other things which will help to improve the milk supply. And as I think you are right now, Vinita, yes, you are live also. So I have just told you about the programs, the weekly programs and the 24/7 programs. You can just enroll. The baby is already 2 months old. So we need to work fast now and get you on exclusive breastfeeding. So relactation is very much possible. And for the medicines which you are taking, which the two things you have mentioned, just see if they are having preservatives. If they are having preservatives, please, I would not suggest having the preservatives added to your body when you are working on milk supply. So Vinita, I would suggest reach out to the team now and get your programs done and just enroll yourself so that you can get a proper support and just get you on exclusive breastfeeding. Next question is from anonymous attendee. Hello, ma'am. Starting exercise postpartum 4 months will affect milk supply. Yes, it will help to improve the milk supply. So exercises doesn't decrease the milk supply, which many mothers think of. Exercises, see, when you are exercising, there is more oxygen transfer to your cells, and that will help to improve the circulation of blood in your body. And when there is good circulation of blood in your body, there is obviously improvement in the milk supply also. So the medicines, so the exercises will not affect your milk supply. And for if you are feeling too exhausted, then obviously you should take more proteins in your food. That will help to like reduce the weight also. It will help to improve the muscle mass. It will help to improve your stamina also. This question is from an anonymous attendee. Hello, ma'am. I had breast abscess surgery 1.5 months back on right side. From then on, from right side, the supply is almost half of the left side. Is it possible to increase supply in the right breast equal to left breast? So it is not about improving the milk supply equal to the other breast. It is about improving the milk supply on the right breast. Yes, it is definitely possible. So as you already mentioned that you had a abscess surgery on that breast, that's why the milk supply reduced. But now when it is all fine, you can definitely improve the milk supply. Just follow the tips which I have already answered, or you can enroll with the programs. Next question is another anonymous attendee. Today, a lot of anonymous attendee. Why are you not writing your names, girls? Anyhow. So you have asked, hello, ma'am, my 4-month baby has been bottle fed right from the beginning. If I start palada feeding now, will it cause nipple confusion or will it help my baby to come on breast? I want to help my baby latch. So again, see, 4 months baby, if the baby has been on bottle feeding from the beginning, yes, it might be a little challenging, but you can give a try. You just see if that is possible, because some of my babies are doing very well with that. So because every baby is different, every mother is different, every circumstances are different. Maybe when you try doing this, the baby is like crying for some days and your family might not be supportive for that. So see also what kind of support system you have. Just talk to your family once. If they are ready, they are more happy, because that will help. Because if you are going against your family, then you will be able to like do it for few days, and then you will get like, obviously when there is no proper support system, then you will feel bad, because once the baby cries, everybody will start blaming you. So that way you have to first get just talk to them and let them know, see, I want to do this, but I need your support. I don't want any negative things from you all. My baby would be crying. It is equally hard for me also to see my child crying, but whatever I am doing is doing for the baby's good. So you have to support me there. If you can't support me, at least don't demotivate me. I'll do it by myself, but please don't demotivate me. So this way you will be able to just focus on your baby. And I would definitely suggest you trying for that. Next question is from another anonymous attendee. My baby is 2 months old, and after switching from formula to breast milk, his poop was watery initially and now it's foamy and loose, and he farts a lot too. So right now, if the baby is on exclusive breast milk, I would definitely say nothing to do. Let it be. Because once you are shifting from formula milk to breast milk, or from breast milk to formula milk, the gut microbiomes, they change. Previously, the baby was having formula milk also. Now the baby is having breast milk. So the gut will change. The microbiomes in the gut will change. So this might be a little disruption in the beginning, but that's completely fine. If the baby is on exclusive breastfeeding, gaining weight properly, then definitely don't worry about anything. Just keep giving your milk and be confident about your milk supply and the milk quality. Don't worry at all. question is from another anonymous attendee. My son is 3 months old. He is drinking 90 ml of formula milk and small amount of my breast milk. When I express my breast milk, my quantity is 10 ml to 30 ml. Only rarely I get 40 ml. I want to give him exclusive breastfeed. Please help me. So first of all, anonymous attendee, you have to understand one thing, that if you're pumping and you are seeing 10 ml to 30 ml or sometimes 40 ml, that doesn't mean that your breast is producing only that much amount of milk. Breast milk supply changes throughout the day. And when you are also doing breastfeeding directly, and if you're pumping in between, then the pump will not give you the correct idea of how much milk you are producing. When you are doing breastfeeding, like direct breastfeeding, and you are pumping in between to check the milk supply, the breast will the pump will be able to take out only 30 to 40% of what milk is already produced in the breast, because your brain is not habitual to pumping. Your brain doesn't understand that kind of demand. So it will take few days for your brain to understand the demand of the pump and will release the milk accordingly. So if you are breastfeeding your baby directly and pumping in between to check the milk supply and you see less milk supply, please don't worry. So you have to just put your baby on the breast regularly if your baby is coming on the breast. If your baby is not coming on the breast and you are expressing and you are doing a regular pumping, then you have to pump as per the amount of formula feed which you are giving to your child. So once you are working on the demand and supply, the milk supply will definitely increase. Next question is from Shiftar. What is cluster feeding? Okay, so cluster feeding is like a kind of pattern of by the babies where they demand milk in small intervals of time. So basically, till up to 3.5 months, the babies are doing cluster feeding at least 3 to 4 hours in 24 hours. But usually at the time of growth spurts, like 2 weeks, 6 weeks, 3 months, 5 months, and 7 months. During the growth spurts, they are doing cluster feeding more frequently, because during growth spurts, their body is growing very fast. So they are needing more milk, and so they do more of cluster feedings. Next question is again from Shiftar. Which pump is good and how to pump correctly throughout the day? So which pump is good? Now it will all depend on what kind of support system you have. So basically, you have to understand that pumps are only to ease your process. It is not about which pump is good. I have mothers who are giving me random ideas about this brand, that brand. So because I have not seen a single brand which helps a lot for improving for the pumpings. So you have to just see which pump works best for you. But I would definitely see that if you're working on the all other things and your pump, whatever milk you're collecting with the pump is fine. Once you keep working on the other things, the milk output will improve. And it is not only about the milk output, it is also about the milk quantity also and quality also, I mean to say. Okay. And how to pump correctly throughout the day, that has to be worked upon, like what age is your baby. If your baby is less age, you might be pumping for like 3 hourly, and later on it might be 4 hourly. So it will be depending like what is the age of your child and or what is the demand of the baby. So it has to be worked upon that way. Next question is from Dakshayani. How to connect to your team, ma'am? Please just drop in a mail and we'll connect you to the team. Next question is from Shiftar. For how long do babies usually feed during every breastfeeding session? Now, again, a cross question. Do you do we eat the same way as elders? Maybe one chapati, one person might be taking 5 minutes to eat, other person might be taking 10 minutes to eat, third person might be needing 15 minutes to eat. So that's why every baby is different. Some baby might be finishing the breast in 10 minutes, some might be taking 5 minutes, some might take 25 minutes. So it is not about a usual feeding which has to be done, but you have to see the weight gain of your child. If your baby is gaining proper the weights as per the norms, then definitely whatever time they are taking, it's perfectly fine. Next question is from another anonymous attendee. My baby is 6 months old, but he still doesn't want breast milk, and my milk is 50 ml in a day comes. So fine, see, your baby is 6 months old, so obviously now solids will start. And when you say that breast milk doesn't come, it is only 50 ml per day, you can work on improving the milk supply. I've given a lot of like suggestions during the webinar. You can work on it. And if it feels little difficult on working alone, then there are different kind of programs which we are offering. Weekly consultations we are offering. We are also offering 24/7 consultations where the doctors are available for you with you 24/7 to help you out. Next question is from Shalini Sharma. Hi ma'am, on pumping every 2 hours, I get around 30 to 40 ml of milk, which I think is low milk supply. My baby is 2 months now with a birth weight of 5.05 kg, but is formula fed 60 to 80 ml 4 to 5 times a day. Is it possible to eliminate formula milk completely at this point and only exclusive breastfeeding? So your baby is right now 2 months old. Yes. So 2 months old, see, it is only 8 weeks. The baby is just 8 to 9 weeks right now. And birth weight was 5 kgs. So because the formula milk is 60 to 80 ml 4 to 5 times per day, and you are also pumping and getting 30 to 40 ml of milk. See, you are already getting milk. So it is just to scale up the milk. Yes, definitely you can get the baby on exclusive like breastfeed, like exclusive breast milk. And if you're also wanting to get the baby on directly breastfeed, then the growth spurt is like arriving in around 2.5 months. The baby will enter into growth spurt. That time helps a lot because the babies are doing frequent feedings. And if the milk supply is good, the latching can be a helpful factor there. And we can get the baby on exclusive latching also. That can be tried upon. Next question is from Shiftar about pumping baby weight 5 kgs, 10 weeks. 1 hour pumping yields only 40 ml from both the breast. So what is the question, Shiftar? Next question is from anonymous attendee. Hello, ma'am. I have been hand expressing milk instead of pumping because pumping is painful. I contacted the breast pump support, but still I did not get the answer on how can pumping be less painful. As I am working on improving supply, when only hand expressing is okay, or I need to pump only to increase supply. So one thing is you can do hand expressions, but it is too tiring to do hand expression for a long time. And when you have to do like exclusively expressions, then doing frequent expressions might be difficult on doing hand expressions. Now coming on the part why the pumping is painful, there are a few things which I can suggest upon which you can try for that. First of all, what level you are putting the pumping on. Many times I have seen the mothers are putting at the highest level and then putting it on the breast. So first of all, start with a lower level and gradually increase. Second thing, many times they are opening the like starting the pump and then putting it on the breast. No, first put the breast pump on the breast and then on it. That will be like less pressure on the breast, so you will not feel pain. Third, if you are pumping for long hours, so basically frequency is more important than duration. So you should do frequent feedings for small intervals than doing a big session and just doing once or twice. These 3 things are important. Fourth thing, flange size. You have to just see what is the flange size. So how you can check the flange size is by if you just make a video from the sidelines, like laterally just make a video of the pumping and see. If the nipple and a little part of areola is in the tunnel, that is fine. If only the nipple part is there, then the flange is small. And if the nipple and a bigger part of areola is going inside the tunnel, that means flange is big. So you need to work on the flange. So if your case, if it is painful, I feel that flange is small. So you can just try. Many times you would have seen in the flange, there is a small silicone layer. So just remove the silicone layer and you can just try it once to check the size. If that feels less painful, you can just have a one size bigger flange. That will help. And fourth thing, if you are pumping on an empty breast, so in that case, just to regularly massage and the compress, that will help to improve the flow, and you will not be needing to pump on a higher grade or for a longer time to express the milk. So these tips you can try upon and just let me know in the next webinar, did it help you? Next question is from Meenakshi Verma. Ma'am, I have 6 months baby and I have only drop milk. It can be improved. Yes, it can definitely be improved, Meenakshi. If you have drops of milk, you can still work on improving the milk supply. It is basically relactation you can work upon because the baby is 6 months now. Please don't waste time in doing by yourself. The baby is already 6 months now. So reach out to the team, get in directly appointments with the doctors and get on board and get your supply issues resolved. So good to know that the questions are done for today. And I can definitely see some of them are regularly attending these AMA sessions. That means you all are like getting help from that. That's definitely good thing. And you can just let me know how are the sessions helping you, how are they like improvising, because every time when I'm coming on these sessions, that sometimes it becomes challenging because after a hectic day sitting on the webinars and just answering, but once you all are like saying that it is going well, it is helping for you all, I really feel good and I feel more motivated to do these sessions more frequently. And very soon I'm starting like twice in a week sessions. So one sessions I'll be working about general information, because now I see still a lot of mothers are suffering with lot of issues. They're having lot of issues, like lot of problems. So I'll be starting one more webinar in a week, and I'll be focusing more on giving lot of information, lot of knowledge to mothers so that they understand about breastfeeding, they understand about the basics of breastfeeding and they can work upon. So very soon, see you all twice in a week. So that will be good. Okay. So everybody take very good care of you and your babies, your family, and good night, everyone. Take care. Bye-bye.